For the past 25 years, the Health Education Council has been dedicated to providing access, education, advocacy, and training to empower individuals to live a healthy life. In order for communities to have the ability to be healthy, their basic needs of safety and security have to be met. We've been working with residents who live immediately adjacent or surrounding a neighborhood park and hearing that it wasn't a really safe place to gather. Part of our work included conducting what's called a walk audit, and there was a shooting right in front of us. How can we expect residents to be physically active if their parks and public spaces are unsafe?
All the lights working?
What started as an initiative to increase active living turned into a deeper recognition of barriers to physical activity. Violence was clearly one of those that we had to regroup and redirect our efforts towards first.
Science has taught us recently that there are adverse childhood experiences that lead into physical health problems. Tell me your name again. Gabriel, got you. Javier. The SHOP program stands for Safety, Health, Opportunities, and Practice. It's a strategy to try to address violence among teens in the South Sac area. If I asked anybody in this room how they would react to a conflict, how would you do it?
For me, if I'm in a good mood, I'll just let it go. But if I'm in like a bad mood, I'm gonna retaliate.
The SHOP is an opportunity for young folks to voice their own opinions about how they feel about things like conflict resolution and violence prevention. We also want to make sure that our physical activity is fun as well. You got a zigzag! With Health Education Council, we are successful at bringing together several different organizations from several different sectors. One of the main examples is our Sacramento Minority Youth Violence Prevention Initiative.
As a collective, we've moved the gauge.
Health Education Council is the lead for a multi-sector collaborative which includes healthcare, local law enforcement, local probation department, along with a few local school districts. You get a different set of perspectives, and sometimes you realize things that you may not have thought about before.
For the last 15 years, violence in South Sacramento has been really at the epidemic rates. That we really needed a way that we were going to be able to all collaborate or come together, get out of our silos and put our boots on, because none of us can do it alone, but collectively we can make a big difference.
Hurt people hurt people. And a lot of times our youngsters that come in the facility have experienced trauma or have come from abusive backgrounds. Through the Health Education Council, it really allows the probation department to be a part of something that's more dynamic, more engaging, and really heartfelt to bridge that gap between what our staff's responsibilities are and what our residents need most.
Do any of you feel like you have a voice in that at all right now, yes or no?
We know that there's a multi-pronged strategy to address safe neighborhoods. We've seen physical improvements in many public spaces, more resident and neighborhood engagement through our Walk with Friends programs. We've seen a reduction in incidents happening in parks, increases in park usage, increase in health status, a lot of increase in what we call community and social cohesion.
Don't be shy, come on, move it. There you go,
Activity begets activity. When neighbors would see that there's a regular walking group and that group would grow from 10 people to 15 to 40 to 50 people, it generated an interest and an excitement. What we know is that an active park with people attracts other people. And in doing so, we not only increase physical activity, we decrease the violent activity in that park as well.
Let's go! Come on, Ellie, let me see those soccer skills.
We have changed the course of so many young people's lives. You know, that now, for once they have hope for their future.